Congresswoman Leah Paquiz is a lady of the moment in the field of healthcare. Blessed by God with a vision to bring reforms to the healthcare system, especially in the nursing profession. She conceptualized the advocacy group NARS, which progressed into NARS Partylist that won a seat in Congress. She is the 2014 Professional Regulation Commission's Outstanding Professional in the Field of Nursing, the 30th Anastasia Hiron Tupas Awardee, the highest award for a nursing leader given by the Philippine Nurses Association, and the 2015 Annie San Recognition Awardee, the most prestigious award given by the National League of Philippine Government Nurses. Aside from being a registered nurse, she is also a registered teacher. She received her Bachelor of Science in Nursing and Master of Arts in Nursing at the Trinity University of Asia. She received her Master of Public Health and Doctor of Education degrees from the University of the Philippines. Her caring skills were honed when she served as a staff nurse in Oriental Mindoro Provincial Hospital. She took care of the poor Filipino schoolers as a public health nurse in the Division of City Schools in Quezon City. She experienced the idea of tamang trabaho, tamang sweldo when she worked as a staff nurse in Goldwater Medical Center in Roosevelt Island, New York City. NARS Leah served as a member of the Technical Committee on Nursing Education and represented the country in various health conferences abroad, such as in the United States, Canada, Switzerland, Israel, and other Asian countries. In 2007, she becomes the 30th president of the Philippine Nurses Association. She started to expose and work to solve issues in nurses' exploitation, neglect, and oppression. After her second term as PNA president ended in 2008, she organized NARS, an advocacy organization which aims to empower health workers and health stakeholders to stand up for their rights and dignity, to provide quality healthcare services to the Filipinos. Thus, the main thrust of the advocacy group, Kalusugan para sa Bayan, was born. She is advocating for nurses to rise above their present exploitative situations by asserting their rights. She encourages them to use their title NARS, hang their shingles, open their own clinics, and join the Nurses Union. On the first day of Congress, she filed 5 House bills, including House Bill 151, entitled Comprehensive Nursing Law, which aims for the nationwide implementation of Salary Grade 15 for entry-level nurses, not only in government hospitals but also in private institutions. The bill also aims for strict compliance of all health facilities to the 1:12 nurse-patient ratio in general ward and nurse in every barangay, school, and establishment to generate employment for nurses. It also seeks to stop false volunteerism and false trainings of nurses. In her first year as a legislator, she filed 9 House bills, one of which is House Bill 3925, entitled Community Health Workers and Services Reform Act. It stipulates that community health workers, such as barangay health workers, will no longer be volunteers but employees and shall receive Salary Grade 1. Strongly advocating for the health of the people and the workers' welfare, she filed an additional 5 House bills in her second year in Congress: the Anti-Discrimination in Employment Act, Health Promotion Act, National Cancer Care Research and Development Authority, amendments to Tobacco Regulation Act of 2003, and Communication and Information Accessibility to the Deaf and Hard of Hearing. Although a neophyte legislator in the 16th Congress, Congresswoman Paquiz already has 4 bills passed into law before her term ends: the Graphic Health Warnings Law, Ladderized Education Act, Scholar ng Bayan Act, and the Open Distance Learning Act. To date, she filed a total of 6 House resolutions which seek to investigate the following: privatization of government hospitals, impacts and consequences of the devolution and healthcare delivery system, violation on the rights of overseas Filipino workers during evacuation and repatriation towards the development of comprehensive standard protocol on repatriation, unlawful importation of mixed waste from Canada, implementation of the Ecological Solid Waste Management Act of 2002, implementation of RA 9173, entitled the Philippine Nursing Act of 2002. As a champion of health workers and Filipinos' health, she headed the filing of the petition for certiorari and mandamus before the Supreme Court to once and for all settle the legal issues that hamper the implementation of Salary Grade 15 of nurses. She also pushed for the inclusion of nurses as one of the healthcare providers who can own, manage, and operate a birthing facility. Despite her busy schedule, she has managed to go around the country to conduct constituency work and legislative consultations. No doubt, Representative Paquiz is the epitome of a great leader and steward, deep-rooted in the love of God, country, and the Filipino people.